how is functional medicine different than conventional medicine? So we know that conventional medicine, it's failed a lot of people and they're seeking answers. They want to try something different, but they might not be so sure how functional medicine is different. Can you talk about that a little bit?
Yeah, I mean, functional medicine kind of takes a holistic perspective. We're looking at the whole person in front of us, not just, little bits and pieces. I think sometimes patients will go to their primary care doctor and they talk about one thing, and then the primary doctor will send them off to a specialist. Okay, I'll send you to a lung doctor, or I'll send you to a head doctor, or let's send you to a skin doctor. You know what? While we're at it, let's send you to a sleep doctor. So I think a lot of people are frustrated with that, honestly, and really what they're looking for is somebody to kind of take the whole person in front of them, put it together, but also look at some of the details that are important. And sometimes people, hear online or maybe through a podcast or a friend that there's all these kind of more advanced testing that they can do to really pick out, okay, what are the underlying issues with their hormones, or what are the underlying issues with their metabolism? Why aren't they losing the weight that they feel like they should be? Or why are they so fatigued and just can't get through a full day of work? And so as a functional medicine doctor, I'm using these advanced tests, and we're really able to sort of like triangulate what are the underlying biochemical issues that are going on. And then we try to put that in perspective in terms of the whole picture. So we're taking lots of, different test results, kind of taking the patient's history. Okay, what are they eating? How are they sleeping? What's their psychological health? What supplements are they taking? Okay, what medications are they taking? And kind of putting it all together, and trying to figure out, okay, here's the underlying cause of what's going on, rather than just trying to treat that symptom that somebody comes in that one time with. We're trying to look at all the symptoms and all the test results and the whole picture and kind of come up with a reason for why somebody's not feeling well. And sometimes that can be one issue, and it's really the underlying issue is just one thing. But a lot of times it's multiple. And so we're not just patching up the hole in the pipe or whatever, the boat. We're actually trying to like fix the whole thing, and take a holistic perspective and come up with a root cause for somebody.
And so how is treatment different? So that's looking at
Yeah.
the whole person testing, but with conventional medicine doctors, they treat with pharmaceuticals, pills. How's treatment different with functional medicine?
Yeah, again, I mean, it all starts off with this like root cause analysis and trying to figure out, okay, well, is the main issue like this person has an imbalance of bacteria in the gut that's causing the bloating? It's causing, food intolerance. It's causing them to be a little bit depressed or down or not have enough energy. Is that why they're, overall feeling anxious and fatigued? So again, it all kind of comes back to this idea of root cause analysis, figuring out what the underlying cause is. And so let's say we figure out, hey, the gut microbiome is like completely, it's shot to pieces. Maybe the patient was on antibiotics, maybe they had an infection of some sort, like a parasite. Maybe they were exposed to something that caused an imbalance in the microbiome. And so once we know that, then we're able to talk about, hey, well, how do we change our diet? What kind of prebiotics do we need to add in? What kind of food should we be eating? What kind of lifestyle should we be living? What sort of follow-up testing do we need to sort of like, okay, are we making progress on changing this? Do we need to add in antimicrobials, like natural antimicrobials, to try to balance things? Do we need to add in more healing nutrients and supplements that kind of heal the lining of the gut? So again, it's kind of generally a holistic perspective, and we're not necessarily just like, okay, well, cookie cutter thing, let's put you on, this medicine, and hey, come back in 6 months, and if you're not better, I'll send you to a specialist.